Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My name is Nazwa Aulia Desya Putri, and I come from class A22.2. And on this video, I will demonstrate about mental health or health issues. And the title of this video is Depression. And happy watching, guys. An estimated 3.8% of the world's population suffer from depression, with 5.0% of adults and 5.7% of persons over 60 years of age being affected. Around 218 million individuals worldwide suffer from depression. Depression is distinct from common mood swings and fleeting emotional reaction to problems in daily life. Depression may develop into a significant medical illness, especially if it is recurrent and of moderate to severe degree. The affected person may experience severe suffering and perform poorly at job, in school, and in the family. Suicide can result from depression at its worst. Every year, around 700 people die by suicide. For people aged 15 to 29, suicide is the fourth common cause of death. During a depressive episode, the person experiences depression like feeling sad, irritable, and empty, or a loss of pleasure or interest in activities. For most of the day, nearly every day for at least weeks. Some cultural context. Some people may express their mood change more readily in the form of bodily symptoms. These physical symptoms are not due to another medical condition. More than 75% of people in low and middle income nations do not obtain treatment for mental problems despite the fact that there are established efficient therapies for them. Lack of finance and a shortage of qualified healthcare professionals and the social stigma attached to mental illness are all obstacles to providing effective care. People who experience depression are frequently not properly diagnosed in nations of all income levels, while others who do not have the disease are frequently misdiagnosed and give antidepressant. 1. Single episode depressive disorder, meaning the person's first and only episode. 2. Recurrent depressive disorder, meaning the person has a history of at least 2 depressive episodes. And the last is bipolar disorder, meaning the depressive episodes alternate with periods of manic symptoms, which include euphoria or irritability, increased activity or energy, and other symptoms, such as increased thought activeness, racing thoughts, increased self-esteem, decreased need for sleep, distractibility, and impulsive reckless behavior. Contributing factors and prevention. Depression results from a complex interaction of social, psychological, and biological factors. People who have gone through adverse life events are more likely to develop depression. There are interrelationships between depression and physical health. Depending on the severity and pattern of depressive episode over time, healthcare providers may offer psychological treatment such as behavioral activation, cognitive behavioral therapy, and interpersonal psychotherapy, and or antidepressant medication such as selective serotonin reuptake inhibitors and tricyclic antidepressant. Antidepressants are not the first line of treatment for mild depression. They should not be used for treating depression in children and are not the first line of treatment in adults among whom they should be used with extra caution. World Health Organization Mental Health Action Plan highlights the steps required to provide appropriate interventions for people with mental disorder, including depression. The program aims to help countries increase services for people with mental, neurological, and substance use disorder through, through care provided by health workers who are not specialists in mental health. An example is the Problem Management Plus Manual, which describes the use of behavioral activation, stress management, problem solving treatment, and strengthening social support. Maybe it is enough for me. I hope you have a good mental health and love yourself, guys. Thank you, and wassalamualaikum warahmatullahi wabarakatuh.